Welcome to the Urban Agenda, a production of the Community Service Society of New York. I'm David R. Jones, President and Chief Executive Officer. For 150 years, my organization has been providing solutions to problems that affect the poor. Today, as never before, low-income New Yorkers are besieged. Budget cutters on the city, state, and federal levels seek to eliminate support programs that have sustained the poor, the sick, the elderly, and the very young. How will these vulnerable populations cope? To help us in our quest for answers, we have as our guest Manhattan Borough President Ruth Messinger. In office since 1990, she had previously served for 12 years in the New York City Council. A former social worker and teacher, she is especially sensitive to the issues involving women and children. Well, Ruth, can you tell us what the budget cuts in the city will do to all of us?
Yes, I have to make a professional caveat, though, or I'll run out of my profession. I am a social worker.
Oh, that's
Formerly
true.
employed as a social worker.
I'm a lawyer, and
right.
I haven't been disbarred yet.
Right,
That's
okay.
true. It's very important.
Right. Well, let's just be clear that all of the cuts proposed at all three levels of government will be devastating for those people who most depend on government for cash assistance, support, and frankly, for assistance out of poverty and into the middle class. The cuts will be devastating because of how much cash is being taken away from people and how many services are being withdrawn. And as well, the cuts will be devastating because there's no planning being done. So it's hard to figure out which one is worst. And although I know you want to focus to some extent, David, right now on the ways in which these budget cuts will hurt the poor, I think it's really important to tell viewers that it's all being pitched as stop giving your tax money to those people, because the assumption is that that will make a lot of people buy into the schemes. And we need to remind viewers that up to 30,000 people will lose health care jobs, that tenured faculty in the city university are being told don't expect to be here next year, that if you take cash assistance out of some neighborhoods in this city, all of the small businesses that depend on the families who spend that cash in their grocery stores or at their dry cleaners are also going to find themselves in serious jeopardy.
I think along those lines, I think they've been very successful in convincing large segments of the middle class, black, white, and brown, that this is not their problem. And I guess it's interesting to, as we start to perceive it, the impact on the whole structure of medical care, on transportation services, and just quality of life, obviously, will become unhinged if we're not careful.
Right. You know, a family in this city that makes $25,000 a year, which some families do by virtue of putting two jobs together, you know, two working adults or one adult holding two jobs, those families think of themselves as middle class. They hear a middle class tax cut, they beam from ear to ear. You know what their dollar value of their state tax cut will be? $4 a year. Jesus. And they'll be paying for sure 25 cents more each day in subway fare before the year is out. At least I fear that. If they have anybody counting on any tuition assistance program for which a family of under $25,000 is clearly eligible, they'll spend a lot more than $4 in a tuition increase. In fact, they'll spend $996 more in a tuition increase, probably.
Well, if we accept, and maybe we shouldn't, that the mayor has a major revenue shortfall, where should the cuts be taken? How do we come up with this cash to balance the budget?
Well, I do want to accept that there is a serious shortfall. I want to make a distinction, quick distinction, between the state and the city, because the state budget is the one that's going to be adopted, supposedly at least by the end of this month. And in that case, the shortfall that the governor is closing is a shortfall significantly of his own making by putting these tax cuts on the table and then announcing that in order to close the gap, he's got to take all of this money out of the Medicaid, out of welfare, and out of higher education. So he's creating a problem from which we're going to suffer. City level's a little bit different. There are some tax cuts that the mayor proposes for this year and particularly for next year that I believe should not be made when so many basic services are threatened. But I don't want to suggest to you that it will be easy to close the gap this year. I do want to say we got to look at what's causing the so-called structural imbalance in the city's budget. Basically three things: debt service on capital investment, the cost of Medicaid, and the cost of health benefits for our employees. Now, the only one of these that the mayor has really looked at, tried to get a handle on, is Medicaid, And of course his solution is crazy, is simply eliminate dental care, eliminate reimbursements, support the governor in taking away home health care. That will leave more people without any coverage for health services they need, and in the relatively short run will end up picking up the difference. A serious targeted effort to figure out how to control Medicaid costs, or in the case of health benefits, and you might not have expected me to say this, but I think the city does need to look at copayment. But they shouldn't look at copayment as every single city worker will cover the same amount of his or her health benefits. If we're going to have copayment, I ought to be paying a higher dollar cost for my own health care coverage than someone in my office who makes a third of what I make. And we're not talking about it that way.
Well, why not? What do you think's going on here? Clearly, you know, this has become the administration, both in Albany and New York, have been able to put out almost anything on the table and really not get much of reaction as of yet. What's the dynamic that's allowing this kind of?
Some of it, I think, I suggested. Well, what's driving them increasingly, it looks to me, is the most conservative notion that government should get out of as many businesses as possible. That the fewer people working for government, the fewer things that government tries or pretends to do, the better, by definition. There's no real logic in that, and we've disproved that a few times around, but that does seem to me what's motivating a lot of this thinking. Second of all, they seem to be getting away with it because of how they're selling it, and I have to give them credit. People think I get a tax cut back, other people get hurt, instead of understanding the real implications of this. The sad thing is that precisely at the time when there is a gap to be closed is when you need people who believe in government, who believe that government does not work efficiently, and for sure, I think anybody who's been around for a while knows that to be the case, and are looking to make services work more efficiently. And instead, they're satisfying all kinds of people by, I mean, here's an example. The mayor can boast now, and does, that he's decreased city employment by 13,000 people, and he's got another 6,000 to go. And he just announced another round of severance. Now, if I were to say to you, well, what's the value of severance? The answer is clear. It's better to leave at your own timetable with $3,000 to $15,000 in a lump sum payment than to leave with a pink slip. But you know what the real effect of severance is right now? The best people are leaving the city. The people who know that they are employable are leaving fast. And in agency after agency, we've basically allowed the workers who leave to decide how many people should be left, because the city is not doing redeployment at the rate that it needs to. So if people cared, for example, about health services, basic, not hospital services, but basic public health services, they wouldn't let anybody else leave the Department of Health until they figured out a way to fill what we're now calling hard-to-fill positions. Well, you know what, David? If they were hard-to-fill positions, why didn't we figure out how we were going to fill them before we let workers take severance? Because a hard-to-fill vacancy in the Department of Health means that many fewer kids will know about immunizations, will get vaccinated, will be prevented from preventable disease. And guess who pays? Of course the kid, of course the family, but the entire city as well.
I think one of the things that conservatives have also won on is the notion that they know how to be tough and have good administrative oversight. It was interesting to note that in a prior round of budget cutbacks, the revenue shortfall that the city was confronting, $250 million of that was overtime, particularly in police and fire. And I don't know what the take is. Is this something that, why isn't that being picked up?
I don't know. And
that
actually,
some of the revenue shortfalls are again, of the administration's own making.
I don't know why it's not being picked up. It's grossly out of control, the issue of overtime. And in today's Post, and surprising that it is in the New York Post, an indication that the hiring of temporary workers is out of control. Sure. Well, you know, so what this tells anybody who looks at the stuff is these guys are not managers. They're not managing. They don't have a vision and a plan. They are using actual shortfalls as an excuse to just cut and cut and cut. And the more businesses they can get us out of, the better.
Well, I think I know one of those businesses all too well. I serve on the board of the Health and Hospitals Corporation, which has just been the subject of a highly critical examination by the New York Times, looking at infant mortality rates. It's interesting that my own organization, I guess about 4.5 years ago, did a study of one of the hospitals which showed much the same thing. What is your feeling? The mayor now is saying that as a result of this study, showing higher infant mortality rates and less positive birth outcomes in municipal hospitals, that this justifies his idea that this should all be turned over to private sector supervision.
Well, this is called a fairly classic non sequitur. Now, let's first say that I find the articles, a series of articles, distressing. And in this case, you cannot criticize the newspapers for their timing because, in fact, this is information and data and research that was done a while ago and not brought to public attention. Now, I want to be clear. We need some additional comments on this study because we do need the one issue that some people have cited that I'd like some more data on is we know that the women who are delivering in the municipal hospitals are likely to present with a larger number of health problems, risk factors, everything up to and including drug abuse. And I want to be sure how far the study has corrected for that, because you have to assume with women with higher risk factors you're going to have more negative indices. But I must say I'm impressed by looking at at least the articles, that there was some correction for that, and it's still higher. Now, here's the funny thing. Oh, it's not funny. It's tragic. But the mayor says, all right, so look, it's much riskier for a baby to be born in a municipal hospital, so it shows the municipal hospitals are no good. So here's a big argument for the city getting out of the business. But guess what? You know, the health care in those municipal hospitals was contracted by the city to be provided to any pregnant or delivering woman who went in by a voluntary hospital under an affiliation agreement. So it is at least as accurate, perhaps more accurate to say, we've been paying $500 million to the voluntary hospitals in this city to provide care, and in at least the hospitals named, they chose to provide a lower class of care with fewer practitioners and fewer specialists and less availability of trained doctors in the delivery rooms of their municipal affiliate than they did in their own hospital. And that story is on the front page of the New York Times. On the inside page of the Daily News is another audit by the same New York City controller, by the current controller, showing that in one affiliation agreement, there is very little evidence that the affiliate doctors were at the municipal hospital when they were supposed to be.
I think this is one of the dirty little secrets that's going on. I mean, I think people forget too soon of why we have a municipal hospital system at all.
Well,
I mean, it sort of just came and descended on us as I guess, a democratic plot. At least my history of it is basically because voluntary hospitals of the time were unwilling to treat uninsured, that the city was forced into the position of having to come up with its own system of health care.
Well, not only that, but somewhat typical of what I call the shoot-from-the-hip style of this mayor. As you know, he held a press conference to announce that he had 3 hospitals up for sale. He forgot to tell the head of the Health and Hospitals Corporation, the chair of the board on which you serve, and the board as well, the community advisory boards to those particular hospitals, and when asked by the press, the portion of your question, namely when asked, what about care for indigent people in New York who are not eligible for medical coverage, he said, there's no problem. The voluntary hospitals are obligated by law to treat them, which is a lie.
They can't.
I mean, this is not a less than accurate piece of information. A voluntary hospital is obligated to provide emergency medical care to an indigent patient. You're right that historically that wasn't being done.
Right.
But the only legal obligation is emergency medical care, not standard medical care. So the mayor seems willing in his pronouncements to eliminate the provision of non-emergency medical care to the, let's be clear, over 1 million people in this city who have no coverage.
I think we were also amused that if you start to line up the institutions that seek to privatize, it has no relationship with the higher indices that are being reported in these papers. Well, so they're,
and also,
unless pick the ones that are so damaged, I'd assume those should privatize first. But that isn't the case.
Well, and then one other point about this sale of the municipal hospitals, I have to assume, and again, we have to give them credit for misleading the public, but I have to assume that if we went out on the street now and asked people how much of the several billion-dollar budget of the corporation they thought would be saved by selling the hospitals, they would say all, whereas in fact the sum total of independent tax levy money in a $3 billion hospital system is $241 million.
And dropping.
And so the mayor has actually been heard to say in one press conference that he's for the sale of these hospitals, even if it doesn't save us any money.
Yes.
Which is a...
Well, we're doing so well in the state and city. How about the feds? There's discussion on food stamp reduction, block granting food stamps, a whole range of other programs that will be eliminated or contracted.
Well, I don't know quite. I wish I knew.
Where should you start? Is always
I wish I knew the right analogy with which to describe this, but this is another arena in which we're being fed sort of a line. The notion that there should be more local decision-making over how to spend federal tax dollars, because you can make better decisions at the local level, has much validity. I have often advocated that. But in this case, we're taking programs that we got Congress to set up because it turned out that cities and states would not do it and would, in fact, try to do it less well than the neighboring state in the hope, the pious and somewhat ridiculous hope, that all our poor will leave and go someplace else. We now have the federal government saying, guess what? We'll take programs of demonstrated effectiveness, and we'll give you the money, but we'll give you less money with no guidelines. And you'll have to pick and choose among the people who are hungry, the children who are neglected and abused, the mothers who want daycare, and you'll have to decide. Well, it's clear that terrible decisions will be made, that the most needy will not get assistance. And the interesting thing to me is that the farmers fought back. The farmers said, wait a minute, we didn't used to think much of food stamps. We thought those were, you know, gifts to poor, lazy people. But guess what we've discovered? Those are people who use those pieces of paper to buy the food that we grow. And so we want to be sure that that program is not eliminated state by state. So we want to lobby the Congress to keep that program in place. In this city, Con Edison, the New York Phone Company, the supermarket chains, the clothing stores, and the landlords should all be doing precisely the same thing. But they don't seem to understand yet that if we let the governor cut public assistance benefits by 15%, they're going to have a lot less income going across their counters.
It's bizarrely enough one of my hopes that basically because none of these cuts can be surgical enough, just to isolate on the people we don't necessarily like, immigrants or poor blacks and Latinos, that ultimately there is going to be a pushback. I think one of the indicators of that was I used to run the youth service agency of the city and made a big deal about trying to get into not only minority neighborhoods, but out into white ethnic neighborhoods, particularly in parts of Brooklyn, Queens, and Manhattan. And because those kids out there are getting out of school at 3, have nothing to do, no services whatsoever. So when the mayor, I think much to his surprise, went out to Bensonhurst, as many of your viewers may know, and was roundly criticized because what are these parents going to do? They have to work 2 jobs, just like everyone else trying to struggle in the city of New York. And what do their kids do staring out into space except to get into trouble and not get ready for a very tough world out there?
I absolutely agree with you, and that was indeed the cry from the people of Bensonhurst, and maybe it will eventually have some impact. The scary thing is that it hasn't so far.
No, it's going to take a while.
And you have the mayor saying that he will literally have the current Commissioner of Youth Services coming to my borough board budget hearing and saying that the budget of the Youth Service Agency will go down from $70 million to either $30 million if we're lucky or $20 million if we're not lucky, and that the mayor is committed to youth and youth development, and he said it with a straight face.
That number is lower than the budget I managed, and that was, I'm afraid, quite a while ago. What about the notion that's now becoming sort of the touchstone of conservative philosophy, which is workfare for welfare recipients? Both Pataki and Mayor Giuliani have touted this as the saving grace for welfare in the state.
Yes, they have. I think there's several things to say. I want to say the broadest thing first, and that is another area in which the mayor has done a good job of sort of hoodwinking not only the public, but I think the press, is to suggest that anyone who disagrees with him is for the status quo. I'm not for the status quo. You and I both agree that the hospital system, for example, needs to restructure itself. And the welfare system, nationally, state, and locally, certainly should be increasingly oriented to helping people get jobs. not only because that's good public policy, but because most of the people
want
on
good
public
jobs.
assistance want jobs. So the system needs some changing. But to simply announce you can't get a benefit unless you get a job ignores the most basic fact. That is, by the Office of Management and Budget's own study, we do not anticipate any growth in employment opportunities in this city over the next 4 years. We already have a substantial number of countable unemployed people. That means people going out and looking for work. Why would an employer with a relatively limited number of jobs hire someone who is just coming off of a period of, let's say, 2.5 years of child rearing without adequate employment opportunity and experience, when there are people who were laid off from a city job or a healthcare job yesterday? So our estimate, which we're about to release in a month or so from the Welfare Reform Task Force, says a couple of things. It says that there are probably 7 times as many people looking for jobs as there will be jobs in the city economy in the next few years. Says, that's the bad news. The good news is there are companies that have had success in hiring people out of welfare to work training programs. There are some examples of so-called workfare programs that provide training, that offer daycare, that give an earned income tax credit that extends over time, that have showed some possibility of helping people to become employed. I'm all for using some of those programs, but it doesn't come free, and you don't do it simply by announcing to somebody that their benefits will be terminated. You have to plan for it, pay for it. You certainly have to provide daycare, and instead the mayor's threatening to remove 2,000 daycare slots. So I'd love to have us do a serious welfare to work, job linkage, not give tax benefits except to businesses that promise to help create jobs, target some of those jobs to people moving out of longer term unemployment. But you have to plan for it. You can't snap your fingers and make it be so.
You know, it's interesting. The Michigan experiment with the removal of people
Right.
from home relief has gotten relatively little play, despite the fact that New York seems to be replicating it in many ways, even with some of the same personnel who instituted the Michigan plan. And in that, as you know, in that study that was done after that program of basically kicking singles off any kind of support, a fraction did go back to work.
I think about
but,
20%.
But the vast majority ended up even further impoverished and desperate. And who knows the costs that that'll roll out.
Well, and I might mention, we did just complete our Borough Board and Borough President budget hearings. No agency has planned for or anticipates or will comment on any increase in unemployment, any increase in homelessness, any increase in hunger, despite the fact that sister or brother agencies of theirs are imposing the kinds of cuts that by definition will create that situation. The city's Office of Mental Health sent somebody to our hearings to report happily that they were not going to be subject to a cut. And I had to ask questions to ascertain that it was, of course, indeed true that since the state is eliminating all mental health funding, there will be 10,000 fewer people served in this city, even though the city is not directly imposing a cut on its staff. Why didn't they come to report that and express their concern, hopefully the mayor's concern, that we tell the governor not to make this kind of a cut that would be devastating to the city?
We've presented a fairly grim view, and that's the trouble with
Right.
us do-gooders sitting around. What do you tell an audience, and what do you tell your audiences as to how we're going to fix this situation? Clearly, there's going to have to be a process here where some of these experiments are going to go forward. I think people are going to have to raise legitimate questions, but many of them will be implemented. How do we start to rebuild a new consensus here that comes up with some of the arguments that the conservatives have used, but comes up with our own formulation?
Well, I tell people a lot of things. Actually, one place I start, which we've really had almost no time to talk about in this half hour, is I tell people about the programs that work. I tell them, that there are schools that are doing a phenomenal job in really poor neighborhoods with innovative principles, that there are programs that are putting people on welfare back to work and giving them the assistance they need to tide themselves over.
Right.
Because if people don't know that, there's no reason to believe there's any hope in keeping any of these dollars and any of these programs alive. I try to explain to people the extent to which we are, in fact, all in the same boat. There's a new effort to fight some of the budget cuts called the Same Boat Coalition.
Right.
And to explain that while we need to be strategizing to improve services, to cut unused hospital beds, to figure out where else in the city budget we can really take a piece out, this is not the time to promise large tax cuts. This is not the time to take more money out of a shrinking city pot, because if we do, and if we cut services, businesses will choose to leave, families with resources will choose to leave, and the city faces a very serious risk of falling further into poverty and not being able to help itself out.
I know I see that. I've been arguing with some big business leadership. I live in the edge of Bedford-Stuyvesant still, and in a neighborhood that was basically middle class, blacks and Latinos, mixed with poor people. Over the last year, you can see substantial deterioration in what had become a very active, gentrified neighborhood. Our park has no swings, and little kids can't go into the park anymore because of the sharp increase in crack abuse. There's no police protection, and there's no park maintenance left. And this was a brand new spanking park 5 years ago.
Right, probably done, by the way, with City Council and Borough President money, because we've been doing all of the capital improvements in the parks with, as you say, no maintenance backup.
But I think it's critical to engage. What is the business community's reaction when you talk to them? Because they've been a loyal supporter for many of the programs that are...
yeah, and I guess no group is monolithic, and it varies. The variance is even wider than I might imagine. You have business people who care passionately about quality of life, ability of their own workforce to arrive on the subway on time, are aware that we need to invest in the best of our public university programs, concerned about the transit fare. And then you have business leaders who say, just cut another 80,000 people off of the city payroll. I'm sure it'll be fine. So we have a big education job to do.
Well, thank you, Borough President Ruth Messinger. It's been very kind of you to join us. We live in uncertain times. The triple threat of support reductions on all levels of government could swell the city's current 1.2 million on welfare, increase the number of homeless, and allow untreated infectious disease to rise to epidemic proportions. If this happens, not only the poor will suffer. All of us who share the city we call home are at risk. This is David R. Jones for the Urban Agenda. Thank you for joining us.
To comment on the Urban Agenda or for more information on CSS, contact Community Service Society of New York, 105 East 22nd Street, New York, New York, 10010. Area code 212-254-8900.